the Conservative NHS Bill, which they're trying to rush through before the summer recess. If you Google it, it looks like it's a pretty benign bill. It's an ideal. This is the Health Service Journal. It's the ideal opportunity to improve workforce planning, and this is another. This is in Left Foot Forward, which is supposedly lefty article saying that the health and care bill is worth tinkering with. There's lots of good parts in it, but there's stuff that's not mentioned in that. And I'd like to speak to Dr. Gill. Are you there?
Hi, Crispin.
Hi. Now look, we spoke on the phone yesterday. I mean, I googled the bill, and there was no evidence that there's anything suspicious about this bill. It seems to be such a good idea. It's helping patients, it's helping the NHS, and it's good for resources and all that kind of thing. Can you tell us what the reality is about this NHS bill?
Sure. Well, whenever our governments try and introduce something extremely damaging, they have to prepare a cover narrative. And the cover narrative for this bill is we're learning the lessons from the pandemic. But the reality is they're doubling down on all the policies that led to our catastrophic response in the pandemic, apart from the vaccination program, of course. So what the bill is hoping to do is to create new public-private partnerships, which will control the budgets of the NHS. So these will be called integrated care systems. Now, the word integrated is very attractive, very appealing, but that's, again, it's deceptive language. What this is all about is integrating budgets, integrating secondary care budgets, primary care budgets, and in due course, what's left of the social care budgets into a central pot. There'll be 42 of these new legal entities. And what they will run as the American managed care system. Now, managed care in America is all about profit. These 42 integrated care systems will have a fixed budget, look after 1 to 2 million population, and from that fixed budget, they will be allowed to make a profit. So you will have private providers like Virgin, like Serco, and the big four accountants and the insurance companies like Centene and United Health sitting on the boards of these new bodies and deciding who gets the contracts. So they will be distant organizations, no central government control, a lot of autonomy to flog off assets, to flog off land, to close hospitals. But the biggest way they will generate profit is through the denial of care. Now, the central player in all of this, you could rename this bill the United Health NHS Budget Capture Bill, because that's what it will enable. The United Health is America's biggest insurer, and through its UK subsidiary Optum, has gained a significant foothold in the back office financial functioning of the NHS, but also their personnel are in high positions in the NHS. You couldn't get any higher than the chief executive, Simon Stevens, who was formerly the president for global expansion for America's biggest insurer. And they've imported personnel, they've imported their computer software and algorithms, which are going to decide who will get care. So you will have a deadly postcode lottery incentivized to make a profit from a fixed budget, and nobody knows about it. It is truly catastrophic what they are proposing. There are other problems with it. One I'll draw a flag up now is what some of these supposed lefties are saying is a good thing, is the repeal of Section 75. Now, Section 75 forces all NHS tendering to be done openly and competitively. Now, me and you don't want anything tendered out to the private sector, but at least if it's open and competitive, it's open to legal challenge and there's public scrutiny. Well, this bill will propose to scrap Section 75, enabling a private sector monopoly within the NHS awarded along the lines of the pandemic crony contracts that we saw, just like with Test and Trace, Serco and Deloitte. So you will have multi-billion-pound contracts being decided without competition behind closed doors. And you have left groups thinking this is a good idea. You couldn't make it up, really.
So all these things that are going on are being, they're not being covered in the media, and then when they are being covered, people on the left are misunderstanding the repercussions of this, or maybe deliberately so. Why isn't the Labour Party saying anything? Do they understand it? I mean, does Labour's front bench on health, do they not understand the implications of this?
Well, I've spoken to John Ashworth personally. I heard him stand up in Parliament and say, we don't want companies like Virgin on the boards of these ICSs. Well, that is supporting the idea of an ICS. So they're completely missing the trick here, either deliberately or out of ignorance. But that's no excuse. Let's not forget, New Labour spent 15 years embedding the private sector within the NHS. The commissioning function of the NHS, the contracting, that was all outsourced by New Labour into what were called then commissioning support units. So they've been up and running for over a decade. They've been managing all the contracts with, entrepreneurial GPs fronting it up, but having no real decision-making power. So, it's been a joint enterprise. What is actually taking place is our governments, our politicians setting up our beloved public service and the budgets to be raided by a foreign corporation. That's what's going on. And Labour are complicit. And the United Health Optum have been awarded, we've done some research into this, at least £17 million to go around training local councillors and NHS leaders into the advantages of this new system, new way of doing things. So, we've employed the private sector to go around brainwashing the politicians, the local politicians, the national politicians, and NHS, leaders in this toxic managed care, the subject of which was covered by Michael Moore in his film Sicko. That was all about managed care and how these insurance companies and providers collude to not provide health treatment for the sickest.
So what can we do? I mean, before I ask what we can do, I mean, we've had the data grab, and that's been moved on. You came on last time and you spoke about that, and that's the government have pushed that one further down the road because they obviously worried they won't get it through and there's too much controversy. This has come in at a different time and people have been caught unaware of it. What do you think we can do? Just can you suggest any actions we can take?
Well, I think the first thing is, the white paper was published back in February, so we've had a few months to get our head around this. There's no excuse from the Labour Party or the unions not to know what's going on. But certainly, if you're a member of the Labour Party, if you're a member of a union, particularly a health union, we need to be pushing our leaders to say, what are you doing about this? This is an existential threat to the NHS. This could be an irreversible handing over control of the budget. What are you doing? And, I encourage, thank you for inviting me on. Whoever wants to learn more about this, our biggest weapon in this fight is to get the information out there, because mainstream media aren't covering it. They just report press releases from number 10 Downing Street and get fixated on personalities. It doesn't matter who's in charge of the NHS, whether it be Matt Hancock or whoever. The policy is being decided by the City of London, the insurance industry lobby, the banks, the financiers, and the American corporate lobby. The politician makes no difference. We need to get our head round who's controlling, who's dictating what's going on here. We've had a neoliberal corporate coup for the last few decades. And we need to get real and fight what's actually going on.
Yeah. Well, Nicholas has put his hand up, and he seems very keen. He's clapping and put his hand up. He's desperate to speak. Nicholas, do you want to say anything on this?
Yes, please. Hi. I wanted to add something on the political context and the Labour Party. Hi, to what Bob was talking about, and in terms of being caught unawares as well. The move to this US system, which financially rewards local bodies for cutting back services, has a longish history back from 1990, but it was announced to be rolled out in 2014 in Parliament. And when it was announced, and Labour's official response was, accountable care organisations, they are policies developed by this side of the House. That was Andy Burnham's response. That was Labour's response. And Simon Stevens, who is the key author of these, as CEO of NHS England, this is very odd because these policies have first been rolled out and then the legislation is coming in. Whereas normally you would announce it, it would be debated publicly and in Parliament, people would say something. Even the Health and Social Care Act went through a debate, like that. And this didn't. It's just been happening de facto. And Stevens talking about it said, we were very gratified to receive the support of all the main parties. It has been a cross-party project. So the Corbyn project, and if Andrew Fisher is still there, the hope was that the Corbyn project would be true to Corbyn's position, which was renationalise the NHS, and would break with that. Now, it didn't happen under Heidi Alexander. Heidi Alexander left. We had Diane Abbott. Diane Abbott U-turned. This is not clear to people because it sounds like Labour, it's very wishy-washy. Get rid of the Health and Social Care Act. It all sounds the same, whether it's coming from one side of the part or the other, but it's very different. She opposed this. It was called Sustainability and Transformation Plan / Trash and Privatise, Unite called it. And it was opposing systematic closures of services which basically are not profitable. Like everybody knows about a local A&E, which is to be downgraded to an urgent care centre or closed. These are national policies. And she opposed this in Parliament, but she was only there for 3 months. And when she left, the narrative that came out was the NHS is underfunded and understaffed. That was its weak tea position, which was telling us that if you put more funding into it, everything would be fine. And the left picked up on this, and we didn't have a narrative that called out deliberate policies that are getting, that are restructuring. Restructuring sounds boring, but getting rid of your local GP surgery is more concrete. Getting rid of the local GP surgeries that are not profitable. The policy is a reduction in 80% of local GP surgeries. That was announced by Minister David Mowatt in 2017. It's part of this, which is now going into law. And across the spectrum, people oppose this. Tory conference applauded when David Cameron pretended to oppose the elimination of the local district general hospital, because this is part of that. And so the hope was to go against that. So it's now a question of catching up. It's also a question of understanding. John Ashworth put integrated care organisations into policy in 2019. On the eve of the election, he put that out in the Health Service Journal, that Labour would do that in power. And there was very little understanding from Corbyn's office about this. Corbyn opposed this under New Labour. He brought a debate to Parliament which about the closure, the Darzi restructuring that was closing down loads of local hospitals and downgrading them, including the Whittington Hospital, and it's just disappeared from our consciousness.
Can I just come in?
Yes, you can. Please do.
But I'm just thinking, maybe I should bring Bob back in, but it seems to me that there's such a complicated structure that is almost like you're saying. People say just fund the NHS, but there's a deeper problem that's going on, that's been going on for some time.
It's fund what? What is this thing called the NHS? Because it's not the same thing we're getting. It's no longer I'm sorry, Bob. What the problem that the private, I'm trying to be quick on just sum up. The private sector, it's hard, but this is actually quite simple. What the private sector objected to was that the NHS gave everything to everyone. They called it monopolistic. They wanted it that out of the way so that you couldn't sell private healthcare because the NHS was doing it, and who would go and buy it? Few people would, and you couldn't. The private sector couldn't provide stuff like local A&E to everyone, local GPs to everyone. That's not profitable. So you had to roll that back, and it's not just that these ICSs or blah 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 are run by private companies. It's that the thing that they're running is an increasingly smaller menu, leaving a bigger space for private sector, so things are not covered, so you don't have a local district general hospital, you have to travel if you can. You are pushed more and more into the arms of private healthcare, as happens in the US with the state-funded service. Centene is a big player in state-funded services. United Health is a big player in state-funded services, and those services are designed to be minimal and just cover some people and some things. It's not just free at the point of need, it's the full coverage for everyone, universal comprehensive care, which is the enemy of the private sector, which is what's being rolled back to open that up. So that's right.
Thank you, thank you, Nicholas. Now, Bob, are you there?
Yeah. So Nicholas is spot on. I don't disagree with a word he said. Labour's position is very problematic. To simplify this, this is a budget grab by the American insurance industry. And that's how we need to understand it. And in order for private health to flourish, as Nico said, the NHS needs to be salami sliced away. And you will lose access to a GP. You'll have a dumbed down service where you'll get less and less qualified people. There'll be an end to national bargaining. And there will be what's something called downskilling. So you employ the cheapest possible staff you can get away with, who will be working outside of their competence. So you will have traumatized staff overlooking the neglectful care of patients, and we will be seeing mass preventable harm and death as a standard from the NHS. So you'll have a middle class flight into taking out top-up private insurance.
I'm going to bring Charlotte. You've put your hand up, and I'm going to let you put your hand down now.
I want to raise this use of words. We're being given words to use, such as private, such as accountable care, such as sustainability. These words are the absolute opposite of what is happening. We must stop using the words that the commercial people and politicians are giving us to use. They're not adequate to the circumstance. It is not private people who are taking over our public NHS. It is being sold commercially to commercial operators. Accountable care is designed to be totally unaccountable. Sustainability is designed to remove our services. We must get the terminology right for accuracy. These people are deliberately making inaccurate every conversation any of us ever hold. And I think this is urgently needed to be put right. That's all I've got to say. Thank you for giving me the time, Crispin.
Oh, thank you. That was very, very, very good point. And Pam, you've been waving your hand as well. Pam.
Because of what's happened in GPs, people can see that something's not right. And they're coming over, and I'm getting people to write letters to MPs, Conservative MPs, no good writing to Labour MPs because they can't do anything for a start. It's the Conservative MPs that must know what's going on, and they don't. I write to councils, my local council. So if anybody wants to do that in their area, they can contact me. I'll put my email. I've devised a letter. It's so complicated that it's very hard to explain to people what is actually happening because it's so complicated. And I have written some leaflets that I've tried to simplify it. And to me, this is the only way. It's got to be people power. People have got to do something because we, Bob has been going for years. I've been longer than me, and I've been going for quite a long time. But and there's lots of campaign groups. KOMP, Keep Our NHS Public, have lots of information and leaflets on their site. So if anybody wants to do something, but you have to be passionate about it. So that's it, really.
Thank you, Pam. Sorry, and thank you very much. And what I suggest is we get as many of people on this call to share on social media, but also to write to MPs and to write to Labour MPs as well as Tory MPs. Thank you, Bob, for coming on. Really important. Is there anything else you want to add?
No, just to make sure the people who are supposed to be fighting for us, make sure they're not shooting us in the foot. So, for example, Keep Our NHS Public, their position is to support the repeal of Section 75, which will enable a private sector monopoly. So if you're a member of that organization, you need to ask those leaders, why are they supporting a position that helps privatization? Similarly, of the Labour Party, why are they supporting integrated care, which is not integrated care, but American managed care? We need to call out our misleaders and certainly spread the word.